Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Navigating Health Insurance Options, a module by Health Equity Teacher. The objective of this module is that by the end of the module, learners will be able to compare and recommend insurance plans based on a patient's preferences and limitations. So our previous presentation on health insurance was all about health insurance in the United States, the different types, different policies that regulate it, and the impact of insurance and lack of insurance on someone's health. This presentation takes into the clinical context so that you learn how to be able to apply your knowledge about insurance to help individuals find insurance plans that work best for them. Now, before we do that, I'd like to just go over some health insurance terminology so that we're all on the same page. In order to be able to compare healthcare plans, we have to understand different components of them. The first is the premium. So the premium is the amount that must be paid for your health insurance. This is a rate that you pay monthly, quarterly, or yearly to basically buy your health insurance. Now, the deductible is an amount that you must pay for healthcare services before your health insurance begins to pay. So if your deductible is $2,000, you have to pay $2,000 for healthcare services before your health insurance starts to pay for healthcare services. Coinsurance is when you share a percentage of the cost of a service with your health insurance company. So if your coinsurance rate is 20%, after you meet your deductible and your health insurance begins to pay, you still have to pay 20% of your health service costs, and your insurer will pay the other 80%. Now, your copayment, on the other hand, is a fixed amount that you pay for a covered health care service. This may be something like a doctor's visit that you pay when you're there, $20 or so, and this differs based on the plan. Now, your out-of-pocket limit is the amount that you pay during a policy period, the most that you pay during a policy period before your health insurance or plan begins to pay 100% of the amount. So say you pay your deductible and you're paying in your period with coinsurance, but then you hit your certain out-of-pocket limit, say of $20,000, and at that point, your health insurer then takes over 100% of the amount of the payment, despite your maybe 20% coinsurance rate that existed previously. Now, with these terms, we're going to go through how to compare and contrast different health care options. But before we do that, I would like to just give us a little bit more of a visual about these terms and how they work dynamically together. So in this example, we have Jane. Jane has a plan with a $1,500 deductible, a 20% coinsurance, and an out-of-pocket limit of $5,000. At the beginning, Jane hasn't reached her deductible yet. So at this point, she pays for all of her healthcare expenses. So that $125 office visit, she pays the $125. Now, as healthcare costs accumulate and she reaches her $1,500 deductible, her coinsurance begins. So the next office visit, $75, Jane pays 20% of that. Her plan pays the other 80% of it. Now, once Jane hits her $5,000 out-of-pocket limit, as healthcare costs accumulate even more, the health insurance plans will then pay the 100% of her healthcare costs. So the next office visit of $200, her plan will pay that $200. I hope this gives you a little bit more of a visual of how this works in real life. Before we talk about different plans and compare them, we'll talk a little bit more about Medicaid eligibility first. So in order to determine your Medicaid eligibility that I mentioned before in the previous presentation changes based on what state you're in, usually it depends on your income. So you have to compare your income with the federal poverty level as well as the expanded federal poverty level that your state allows for with their Medicaid expansion. As I said in the previous presentation, the Medicaid expansion was opted in by different amount of states. 31 states opted in, 19 states did not, and they opted in at different rates. So what you have to do is you have to look up what is the Medicaid expansion percentage for your state, multiply the federal poverty level by that expansion percentage, and then see whether your income is below that. So say you are a one-person household, your federal poverty level based on the 2021 data is 12,880. Say you're in a state with a Medicaid expansion rate of 110%, you would multiply that 12,880 by 1.1 to get your state's Medicaid eligibility maximum for your household type. And you would compare that amount to your income amount to determine if you're below that, you are most likely Medicaid eligible if you meet the other requirements. If you're above it, you are making too much money to be eligible for Medicaid. Like I said, you have to look up your Medicaid expansion percentage, and you can do that at Medicaid.gov. So Medicaid.gov will have this full chart. I have just a screenshot of it here at the beginning of it, and it lists out by state not only the Medicaid expansion rate in general, but the Medicaid expansion rate for different populations within the state. So different children, ages, pregnant women, women with CHIP, and adults who are caretakers or parents, and adults who are not. So different expansion percentages for different populations, for different states, can all be found on Medicaid.gov very easily. Now, let's get to what we are really trying to discuss with this clinically today, comparing health insurance plans. This 4-step procedure is a very basic outline of what you can do to compare health insurance plans. It may get more nuanced depending on what state you're in and what type of insurance you're looking at. But essentially, what you want to do to find and compare health insurance plans is first go to healthcare.gov. This is a federal platform that can take you to state platform marketplaces for health insurance purchasing. You enter your appropriate information, what state you want, you're in, your age, income, dependents, and maybe some more information about you depending on the state. They have different requirements for what you enter for searching. And then once you enter that into your state's marketplace, that marketplace will then populate different plans that are options for you based on your information. You can then look at each plan and its information. This means its premium, deductible, co-insurance, and more. And based on those, you can calculate the total estimated expenses that you would have with this plan, compare it to your out-of-pocket costs without insurance, and determine the potential savings or costs with each plan, and choose what's best for you. So that was a lot of information, but I'd like to put it into an example for you. So we've got a 53-year-old woman who spends $1,000 a month on her healthcare costs. That's $12,000 a year that she's paying if she does not have health insurance. Now, if we're looking at 3 different policies here, say I've already gone to healthcare.gov, chosen the state, gotten policy options, I've got 3 of them here. They've got different premiums, different deductibles, and different co-insurance rates, and we have to see which one is best for her. So first, we have to consider what these plans will cost her. And to do that, you have to consider the premium, the deductible, and what they'd pay with co-insurance. So they'd have to pay the premium annually, regardless of what their healthcare services might be that year. And then they have to pay the deductible all by themselves before they start getting help from the insurance company, like we said. So in this case, she is paying $12,000 a year on healthcare costs, meaning that with all these plans, deductibles, $10,000, $5,000, and $2,500, she'd meet the deductible by herself. So with all these plans, she'd pay the full premium and the full deductible. Now where it gets different is co-insurance. So she'd have different amounts left over that she'd still have to pay after the deductible for each of these plans, because the deductibles are different amounts. So with policy 1, she's paying $10,000 of deductible and has $2,000 left of her estimated costs. Now, because her co-insurance is 0%, she pays none of that $2,000, and her total cost, based on these estimated healthcare costs, will be $11,400. With policy 2, it's different, because she pays $5,000 in deductible. She has $7,000 left to pay of her healthcare services. She only pays 20% of that, So her total costs for her are $10,200. You have to multiply that $7,000 left by the coinsurance rate of 0.2 to get the amount that she'd pay from that. Similarly, with policy 3, you have to do it again. The amount that she has to pay left over for the deductible is even greater because the deductible is smaller. She has left over is $9,500. You multiply that by the 30% that she has to pay, add it to the premium and the deductible to get $12,750. Now, all the math for those three were different, but it follows the same process. You want to take the premium, add it to the amount of the deductible that they're paying, which in this case is the full deductible, and then add the amount that they have to pay left over based on the coinsurance rate for that plan. So we can see that we have the total cost for policy 1, 2, and 3, and that they're all different. Policy 3 is the most expensive, and it's even more expensive than her annual estimated costs. Policy 1 is the second most expensive, but it's less. She still saves $600 compared to if she was uninsured. Policy 2 is the least expensive. It is $10,200. It saves $1,800 compared to if she was uninsured. So while policy 2 may be the cheapest, it may not be the best option for her. It depends on what she thinks of her healthcare and what she needs. So while policy 2 may be the cheapest, if she has other costs that we're not accounting for, if something happens, a hospitalization, a surgery, an emergency room visit that she didn't account for in these costs, that means that she would still have to pay 20% of those additional costs because that's what her coinsurance rate is. While policy 1, while it's a little bit more expensive, she wouldn't have to pay any of those additional costs because of the 0% coinsurance. So you really have to think. You have to see what the estimated costs are, but then think a little bit beyond those numbers to see what's best for that person, what they think and what they want from their health insurance, whether they want to account for unpredictability or whether they want to risk it and go with the cheaper plan that doesn't pay fully for everything after that. Now, that outlines the subjective and objective portions of comparing health insurance plans. And I just threw a lot of numbers at you with that chart, but I hope that example put it into perspective about how to compare plans and what you have to do. Now, I'd like to walk you through the additional resources that I mentioned before I end this presentation. So here is healthcare.gov, where you're going to find your state-based marketplaces for health insurance. So here you'll go to get coverage. Now you select your state. So say I am in Connecticut. You'll go to visit your state marketplace. This will take us to Connecticut marketplace that's called Access Health CT. And from there you use the state-based platform to look at those states' plans and what's available for you there. So say I want to compare plans here. I'm going to enter my information like I said. So say I am in Harford County, I'm 45 years old, and then I don't have any dependents in this situation. You can enter income annually, and you can put something in there. You can even put in some estimates about how much you're going to use the different healthcare services in order for them to better prepare for your plan and what you might want. You can even search by doctor to make sure that they're included in the plan, or drugs to make sure that their drugs are covered by the plan. And then it'll give you different plans based on your qualifications and your eligibility. You can select them to compare side by side and get a side-by-side comparison of the premiums, deductibles, out-of-pocket maximum, everything about the plans here, and then you can make the decision by calculating those costs that I showed you. You can do it mentally, or you can also use this calculator that we've created and included in this module's materials. So here I've entered the numbers of the situation that we had in the presentation. You enter everything that's not in a gray box. So you would enter Your annual cost we said was $12,000. The premiums for each plan, the deductibles for each plan. It'll calculate for you the cost left to pay based on your estimated healthcare costs after your deductible. It'll take your coinsurance that you enter as a decimal and calculate the cost that you have to that are on you after the coinsurance kicks in, and then it'll give you your total annual cost based on that plan right here in this final column. Based on those numbers, like I said, you can make those decisions based on the math and then the individual's personal values and wants and preferences with the plan. This tool just makes the math a little bit easier and less hard on the mental math in the head. But I hope that you have gained a lot from this presentation on navigating health insurance options and have learned how to compare plans side by side based on their premiums, deductibles, coinsurance, and patient preferences and limitations. Thank you.